I worked in New York City in spring of 2020, and we were pretty hard hit. It was kind of like a 9/11 every day.
It was so bleak during that time. Seeing the cries and screams of people, seeing the disparity that I'm the one working on the road, no one else is on the road, and I'm taking people to the hospital, and that may be the last time they're interacting with that family member or their loved one. It got to a point where I broke.
You can freak out like in the ambulance, and then when we're inside, then we're like calm and collected because we have to reassure them that we're there to help them, and then that we know what we're doing. And even if like inside we're like, oh my God.
When the pandemic hit, many people worked from home. That wasn't an opportunity that 911 EMS was afforded.
They're the third uniformed service. Their job is as dangerous as police and fire. They have been right up in the front lines taking care of very sick COVID patients, constantly exposed to infectious disease.
We met people who have been in it for a lifetime, and they've never seen it more sort of broken than it is now.
I think many people assume incorrectly that EMS is considered this quote-unquote essential service. And unfortunately, in many of the legislative frameworks, EMS was just left out.
One of the biggest challenges with EMS, the way that it is structured today, is the funding mechanism, the economic model.
All across this country, EMS agencies can't recruit, retain, and staff ambulances to a point to ensure the public safety.
One of the biggest disservices that I believe as a very high productive and financially sound country is when we can't take care of our own.
I believe our rural areas are the alarm sounding. We want people to know that this is a crisis that they need to pay attention to.
Particularly rural areas don't have the required EMS coverage. When someone calls 911, there's no assurance that they can get an ambulance.
People always want to talk about the cost of responding to the call, whereas we should be talking about the cost of readiness to respond to the call.
We need to have full-time paid personnel at adequate salaries who have chosen this as a profession. This is a noble profession.
As an EMS worker, it's very difficult to live off of one salary. Therefore, I have to work at several different agencies just to pay my bills.
EMS has not been considered and viewed as a required essential services for the what-ifs. And is that, as a society, something that we are willing to fund and pay for? That's where it starts.
All we're doing with essential services is saying that this is a critical piece of public safety, much like fire and police, and that we want a bill to be able to make sure that this essential service gets funded appropriately and it can deliver the service that the public expects.
It doesn't translate into money per se under state law to simply call something an essential service. We have to rebuild the EMS system from the ground up to create a system that has enough money to sustain itself.